Welcome to Q&A with Nurse Linda on Friday.
Yeah, come on in, guys.
What did you call this, Friday happy hour?
Oh, this is our Friday happy hour. Hey, don't ask. Right?
Fine. I should let you talk since the internet's weird. Yeah, you go ahead.
Well, you know what? I just got a warning like, oh, your internet's unstable. I don't know what that means, but yeah. So, what was I going to say? Oh, we were going to kind of do a topic, talk a little bit about ovulation testing. That is like 90% of my questions over an Ask an Expert are about ovulation testing and what the app's doing and what the app is thinking and what she's doing and what things mean. And it is not always really clear. Even for somebody like me, it is just not always clear. So I'm not surprised it's not clear with you guys all the time either. So we've got some questions we're preloaded with that we're going to attend to. And Terry's going to take the live questions. So we'll give Terry an opportunity to ask those. Okay, let's see. All right, first question. I find that my LH test results show best in late morning around 9:30 to 10. Should I remain consistent with that time every day? And the answer, of course, is yes. If that's your good time, then you got to stick with your time. In general, you'll hear us talk about and you'll read how the recommendation is afternoon generally, which isn't always easy for us to do. I mean, you know, people have lives and are working in that, but here's the reason behind it is when you have an LH surge, it tends to happen in the morning, but we got to wait till it gets to the urine for us to be able to read it in our LH test. So that's why we kind of lean towards afternoon, because that's the time when it's going to be in the urine. I'm leaning towards it, and what I see from the gals that write me so many questions and ask an expert is people are doing 2, 3, 4 tests a day, so they don't mind multiple tests. I kind of like the 2 tests a day. Otherwise, to me, it's more important that we try to get tests in at least every 24 hours. Like you can't do it at 9 in the morning on Monday and then 11 in the morning on Tuesday because you've gone over 24 hours. So I'm just afraid we're going to miss an LH surge, and then that's going to make you, crazy. So I really like the twice a day thing. So morning, evening, afternoon, evening, try to just do it twice a day. And then I know we've gotten it in for 24 hours. But if you know you're good in the morning, then like Terry has talked about this before, then do the morning if that's what works for you. That's most important, not following rules, but what's best for you. That's a good philosophy for life, isn't it?
Yeah.
Know what the rules. Okay. Next question. Very late ovulation after a miscarriage. I'm sorry about that. Those losses are devastating. Normally ovulation was on cycle day 12 or 13. What should I expect for my next cycle? Because she had really late ovulation, like cycle day 42. So yeah, that's going to happen after pregnancy. I mean, quite honestly, after any time hormones are inserted in your life, whether it's birth control, hormone IUD, pregnancy, I had a baby, miscarriage, I was pregnant. Those are all times hormones are inserted in and stop the flow of hormones that talk from our brain to our ovaries. So any of those things stop that communication. And it takes a minute for that communication to come back. So it's kind of like starting a car. So it's going to take a minute. Your brain is talking, the ovaries weren't listening. The brain wasn't talking, oh, now the ovaries are listening. Finally, they hook up, like in your case, it took like 42 days, and they finally got in sync. Now, does that mean, oh, okay, we're back to normal, I'm going to be back in sync every 28 days, cycling after that. No, not necessarily. You could go another 42 days, or you could have a good cycle, then go another 42 days. Like, all bets are off. It's possible. Just know that that's going to happen potentially. Now, you could be one of the lucky ones, and after a miscarriage, you could go right back to normal cycles. You could certainly try to get pregnant right after a miscarriage. There's nothing wrong with that. So when you ask, so I had a big long cycle, so now can I expect to go back? No, you can't expect to go back. It would be nice if you would, and we'd love that. But if you expect it and it doesn't happen, then you're going to think something's wrong. And I don't want that to happen. So just know that for 3 months or so, you could be in this experimental trying to figure out how to get yourself back to whatever your normal is, right?
Linda, can you double check the first question in the Q&A? I think you may have just answered that question. I just want to make sure. Can you see that at the bottom?
Oh, at the bottom down here?
Yeah, check.
Yeah. That could be. Yeah, it's actually, I moved my questions around here. Sorry.
If not, I'd love you to address this one too, but I don't want to cover it twice.
While I'm at it, yeah, it is.
Okay.
It is actually. Yep, it is. So I hope we answered that for you, Laura. Okay. Okay. What else we got? All right. Here's another question. I am having multiple. I get this kind all the time. I'm having multiple peaks this cycle, and that has never occurred. Do I just keep testing? So here's the thing. What the app calls peak, I mean, it like says the word peak. That represents your LH surge, because that's what happens. Your LH goes up real high and then comes down real quick. That only happens one time in anybody's cycle. One time. So in general, in a perfect world, the app should only give you one single true peak. Now, I have seen a couple of times where the app has said peak twice, but sometimes you can, and Terry, correct me if I'm wrong here, you can manually overwrite things and make the app say peak or what have you, right?
Yeah, you should only actually have one labeled peak. Like, as you said before, like it'll give you a peak, but then if you get a higher result later, it'll be like, okay, this is the peak. So you should only ever have one peak in your cycle. But if, for some, like, we recommend that you trust the app, but if for some reason you really disagree with the app, you can override it and put your own ovulation date in there.
Yeah, I wondered if that's what I saw, because I really did physically see somebody's chart where the words peak were there twice.
Yeah, if you didn't do that, then talk to support, because that shouldn't happen.
Exactly. So usually my experience is when a gal says to me, I'm having multiple peaks, what they mean is, and this is totally understandable, they're getting multiple highs. And of course, we naturally think a high is a peak, because that's kind of what that word means, high, but it's not. It's like, I really wish there was a low and not so low. I really wish that were the words we use, because high is misleading, but it does mean, the LH is a little bit higher than it was when it was low, but it doesn't mean anything. There's nothing I want you to do when you get a high. What is critical is when you get the word peak, and you will only get that one time. That means you're ovulating the next day. So you don't actually get multiple peaks in a cycle, but you might get multiple highs. But like I said, they don't mean anything.
Probably a good time for sex, though, if you're getting highs, because you're probably getting close.
That's a good point. Highs before your peak are meaningful, because usually that means you're starting to enter your fertile window. And if you're one of the lucky ones out there and have fairly regular periods, you can kind of guesstimate when because not everybody gets highs, but it is important to know when your fertile window is. And I always tell everybody, your fertile window starts 5 days before you ovulate. Well, how am I supposed to know that? I haven't ovulated yet. Right. So, but you can guesstimate it. basically, if you know, and a lot of gals do know this, if I say to them, when do you think your next period is? They'll look at their calendar. They said, oh, I expect it to be around October 10th. Well, whatever day it is, basically 14 days before that, you're going to ovulate. I should say 12 to 14 days before that date, you're going to ovulate. So now you can roughly see when you're going to ovulate. Now you can play with those 5 days before ovulation, knowing that's your fertile window. And if everything's right in the world, I would say try to have sex every day or at least every other day in that fertile window. 2 days I always want you to hit are peak and the day after peaks. That's ovulation. Those are the two most important days. Okay. And yes, if you're somebody who has, well, I like people, Terry mentioned this a minute ago, you know, you get a peak. As a matter of fact, this happened to us. I just did a question for a gal. And she almost asked me the same thing and ask an expert. She said, you know, she showed me, I have access to all the charts, but she showed me a little picture as well. And she said, oh, I had a peak on this date. And when I looked, it really said high. And I said, well, you didn't have a peak, but you had a high. So we might be getting close, et cetera, et cetera. Well, a couple of days later, she wrote me back. And now when I looked at her chart, the chart turned that high into a peak. And the reason is now her number in particular was 1.21 and it called it high because it's waiting to see if tomorrow you're going to be 1.30 because then it's going to keep that high and it's going to give you a peak. Now, in her case, she started to drop back down like you do after a peak. So then the app said, oh, okay, I'm going to retroactively now turn that high into a peak. And that's what it did. The app especially does this when you're new to it. When you're only into this for 1 or 2 cycles, it's trying to figure you out. Most gals do the same thing, meaning if you tend to peak at 1.2 or thereabouts regularly, now the app knows that. But if you're a gal who it's seen you twice now and you peak at 2.3, it's waiting for a 2. It's not going to fall for 1.2 in your third cycle. It knows you're going to get higher than that. That's how it learns about you, right? So that's why you see sometimes peaks move around, like Terry said. It's because it's learning about you. Do you have anything to add to that, Terry? Okay. Am I frozen or is Terry frozen?
No, yeah, just always make sure. Okay, yes.
Okay.
I just always like, keep going.
Okay. Now.
Go ahead, keep going.
Okay, I'm not freezing up on you guys, am I? I hope not. Thank you, Christine. Okay, let's see what we got next. All right, somebody is on letrozole.
I got a note.
They're asking, when will I ovulate on letrozole? Does it cause late ovulation like Clomid? So if you guys aren't familiar, Clomid and letrozole are oral pills that a doctor would prescribe for you if you're usually, and well, I should say first and foremost, if you're a gal who either doesn't ovulate at all, like me when I was young, or you ovulate really sporadically. Well, we just need to normalize your ovulation. You have to take medication to do that. And that's something like Clomid, which is old. That's been around for a long time. Letrozole is a little bit newer. Usually you take them, and this is actually a question I have. Somebody asked me, combine 2 questions at once here. What's the difference in taking letrozole or Clomid for that matter on days 2 through 6, 3 through 7, 5 through 9? You basically take these medications for 5 days in a row. Different docs prescribe different days. And when I tell you it's absolutely no difference, it makes absolutely no difference. Take them. You're always taking them somewhere in the very beginning of your cycle. And you take them for 5 days. Generally, you will ovulate, generally, about 5 to 10 days after the last pill. So no, they don't cause late ovulation, but everybody's different. Now, not everybody ovulates when they take these either. I mean, I didn't. Clomid is what I took, and it didn't work for me. I didn't ovulate on that. Letrozole's newer and better. People do respond and ovulate on that. Now, 5 days after the last pill, but I've seen it as well. You know, you just keep testing, you know, to see if you're going to ovulate. Okay. Here's a good question. What questions or info should I ask for during my fertility consultation? So it sounds like somebody's going to go see a doc, either their own OBGYN or reproductive endocrinologist, and they're looking to decide what questions they should ask, what information they need to get. So this is important, and it's really important. I want you to understand what you've learned on Premom. I want you to understand your cycles, and I want you to understand what your body's doing. So if you feel like you need to come on over to Ask an Expert or even schedule a virtual consult one-on-one, feel free to do that, because I want you to be educated when you go to see your doctor. If you're not a little bit educated, that's why you're asking, that's why we're talking about it, then the doctor will ask you, do you have any questions? And you'll look at them like, you're staring off into space and say, no, because you're not sure what to ask. And then you're going to lose opportunity. So mostly what you're there to see your doctor about is usually starting out with testing. Right? You've been trying at home for 3, 6, 9 months, 1 year, and it's not working. So you want to know, and that's the other thing. I should stop and say this. A lot of times gals think they really have been trying. I've been trying for 6 months. Sometimes I'll take a look at their charts and the sex is way off or something, or they're really, again, it's not for lack of mental effort, but maybe physically they're just really not having sex at the right time or what have you. So they really haven't been trying as often as they think. But it's time to start doing some testing. I always break this down so simply. It boils down to get pregnant, the egg, the sperm, and the sperm getting to the egg. That's it. That's the formula right there. I'm going to jump to number 3, the sperm getting to the egg. That has to do with, are you timing sex right? If you're not timing sex right, then you can have plenty of sperm in you, but if there's no egg around, little good it's going to do you, all right? Do I have open tubes? That's part of number 3. How's the sperm going to get to the egg if you have blocked tubes? How do you know if you have blocked tubes? Usually you don't. If you've ever had chlamydia in the past, that's a good reason to go get a hysterosalpingogram or an HSG. That's the dye test. That's to make sure your tubes are open, Number 2 is the sperm. Yeah, that's obvious. We need to have good sperm. They have a big job ahead of them. Not to say sperm that aren't so great, maybe a little low on count, maybe a little low on motility. They'll still get you pregnant. It might take a little longer. Will definitely take a little longer. But again, there's sperm there, just not as many. But you want to get a semen analysis done. I want to know how he looks. The best way to get that is through a laboratory, a local laboratory, primary care doc or an OBGYN. Somebody can write a script, and you want to get it done in a laboratory. That's the best way. Now, men are a little shy. They don't want to do that. You want to do something quick and easy. There are at-home semen tests. You can Google or get off Amazon. They're not as good, but it's better than nothing. But check out the semen. You got you. You can't just assume because he's young and good looking, he's got good sperm. That's not how that works. And number 1 is the egg. That ironically is the one that mostly causes the issues with not getting pregnant. And it's also the one that you can literally do nothing about. That has to do with age. And that has to do with what are you going to do? You're 32 years old. Well, your eggs are 32 years old. So you've got plenty of eggs, good and bad. But that's one of the reasons it takes so long to get pregnant. So you want to talk to your doctor about testing. Get some blood work done on yourself. Get an AMH done. Check out your thyroid. Check out prolactin. But if you're ovulating normally, usually those blood tests aren't the primary thing on my list to get tested. And interventions. Is it time to start thinking about IUIs, inseminations? Because that will increase your chance of being successful. Terry, you got anything live there you want to shoot out?
We do. And I just wanted to
drink my water.
Yeah, drink your water. I love that test name. I can't even say it, but it's such a huge word. HSG is that's all I can do.
HSG, that's what I do. I like that even better.
It's such a humongous fun word. We have a couple now. Okay. Let's see. I know there are certain foods or meds that you should watch out for when pregnant during the waiting window to find out if you're pregnant. Should you be cautious of those or just wait to find out you're actually pregnant before being concerned?
Good question. And, you know, I'm going to wrap in one of my questions I got over here. Somebody asked what's safe to take for acne when trying to conceive or pregnant. And because there are true medications like Accutane is an acne medication you never want to take when you're trying to get pregnant. There are big no-nos out there. And there are 1,000 medications that are not safe in pregnancy. As a matter of fact, they hardly say anything anymore is safe in pregnancy, probably for liability. But that's something that, depending on what medications you're on, make sure your doctor knows, or for the time being, just Google, is, Accutane safe during pregnancy? And of course, you'll get a big no, absolutely not. So I don't want to say I can answer all questions here on what medications aren't safe during pregnancy. So you definitely got to look that up or check with the doctor for sure. But like for acne, to answer her question real quick, there are antibiotics that doctors prescribe that are safe. Erythromycin, clindamycin, those are antibiotics they prescribe for acne now, and those are generally safe during pregnancy. Benzoyl peroxide, I believe, is also safe. So there's your over-counter face washes should be okay. But obviously, prescription stuff, you want to make sure you always let your doc know that you are trying to get pregnant. As for foods and that, again, there's a really long list of things, raw fishes and all kind of things that, that are mostly they're worried about things being pasteurized or you getting sick from them. Not that per se anything causes a miscarriage, but certainly medications can. So, but I'm saying for foods and that. So that's the kind of thing that, you want to make sure you know that list. Now, this is a really good question. What about when I'm in my 2-week wait? Well, I'm sorry. To me, it isn't practical to say to somebody, like, let's take a glass of wine. Like, oh, you can't have any wine in your 2-week wait. Okay, that would be half of every single month. That's not like you're saying it for 2 hours. You're saying for 2 weeks. I don't want you to do that. This is my personal opinion, which I'm allowed to have. But I'm not somebody who believes in holding back in your 2-week wait. Now, hold on. I don't mean go out there and tie one on the regular. I'm saying if you're a gal who likes to sit and watch a good movie at night or a 90 Day Fiance like I'm hooked on right now, and you like to have a glass of wine, then have a glass of wine. Don't have a bottle of wine. You're not even sharing blood flow with a baby in your 2-week wait, for heaven's sakes. I worry much more about the stress and strain you put on yourself thinking you have the power to undo a potential pregnancy. You don't stress about those kind of things. You want to make sure you're not, if you do have prescription medications you take and you're trying to conceive, you should always make sure your doctor knows you're trying to conceive, whether it's antidepressants, high blood pressure medicine, any of those diabetic medications. Make sure your doctor knows that you're trying to conceive, because I want you on the safest medications. But during the 2-week wait, just be smart. That's all. Anything else that you have there, Terry?
Yeah, I have one more. Let's see. If you have had chlamydia in the past and the gyno did a vaginal ultrasound after it cleared to make sure there was no damage, do you think that's considering getting a good answer, or do you still recommend the dye test you mentioned before? Dye procedure.
Yeah, you know what? If you're trying to get pregnant, I'd probably go with the dye test. If my daughter had chlamydia, which is likely, if my daughter did, she may, and she's not trying to get pregnant, don't worry about it right now. There's nothing, nothing's going to hurt you. Now, how do I know an infection didn't cause scar tissue? See, that's the problem. When you get something like chlamydia, otherwise known as pelvic inflammatory disease, you may, because it was an infection, you may have a bit of scar tissue. Now, scar tissue in the fallopian tubes is really bad because, fallopian tubes are little teeny tiny skinny things, and they have all these little fingers that help move down an egg. And so any scar tissue in there will just block those tubes right up. Now, of course, who also get pregnant, ectopic pregnancies, tubal pregnancies, or simply the egg and sperm just can't meet because there's a blockage there. Generally, when there is a blockage, they will just remove those tubes. There really is no way of cleaning it out, because you just do more damage when you try to do that. And again, the big risk is ectopic pregnancy. There's not many times something could be life-threatening, but an ectopic pregnancy can. Because if you get pregnant in your tube and that tube explodes, then you risk bleeding. So that's very serious. So if you know you're trying to conceive and you know you had chlamydia, I'd probably have an HSG done just because I don't want to risk an ectopic. So yeah, I would do it. An ultrasound is good, but an ultrasound cannot see into the tubes to see if they're blocked. There's only one way to know if you have blocked tubes, and that's an HSG, or the dye test. What they do is they just insert a little teeny tiny catheter into the cervix. They inject some dye, and with an x-ray, they watch the dye come out the tubes. And if the dye doesn't come out the tubes, you have a blockage.
Good questions again.
Go ahead.
Oh, no, I'm just saying we always get good questions. Yeah, that's all we have for now. So go ahead, keep doing.
Okay, let me look at my list and let's see what we got. Good question here. All right, what would be the best way to determine you're ovulating besides using the test kits? Okay, a couple of different answers here. Probably the best way to confirm ovulation, I should say the best, easiest way, is to do basal body temperature, BBT. BBT means there's special thermometers for this, okay? You can't use a regular old fever thermometer. You've got to buy a special, and we've got them right on our website, basal body temperature. What we want you to do is every morning, have that thermometer right on your nightstand, and every morning before you talk, eat, do anything, get up, take your temperature. It's going to be low. It's going to be 96 something, 97 something. That's called your basal body temperature. Fine. And you're going to register it right in the app. Easy peasy. We even have a Bluetooth one, so you don't even have to do anything. Mm-hmm. And what happens is this. Once you ovulate, you start producing progesterone. That's the pregnancy hormone. That's what supports a pregnancy. What progesterone also does is raise up your temperature just a little bit. We're not talking about, oh, she runs a fever all the time. No. But it raises it up, and it raises it significantly enough that you can actually visualize it on your chart. You can actually see the difference. This is before I ovulated, and this is after I ovulated. It's always higher now. That's a way to confirm you have ovulated. There are certainly progesterone tests, because I just mentioned once you ovulate, you'll start secreting progesterone. There are progesterone tests out there. The urine tests, for me and my experience with my clients, is kind of hit and miss. I'm not sure if it's getting it all the time. People have clearly ovulated, and the progesterone urine tests come back clearly negative. So I'm not sure how much faith I have in those, but certainly if you're worried about whether or not you have enough progesterone, you can get a blood test done at your doctor's office about a week after you ovulate. That will confirm it. Cervical mucus. Now, cervical mucus is, I'm not going to say that's a way to confirm you definitely ovulated, but certainly it's going to let you know you are in that zone of ovulating. When you're growing a follicle in the first 2 weeks of your cycle, it's getting bigger. That's where your egg is living. Your body, that follicle, is making estrogen. So your estrogen is going up a little bit each day, and it'll kind of peak when you ovulate. Well, estrogen does something else. It helps get the uterus ready, but it also creates cervical mucus that is really watery. They call it egg white mucus. You know, when you crack an egg and you see that clear, watery, slippery egg white, well, that's what it kind of looks like. The reason is because, of course, the whole vaginal area is not sterile. It's considered dirty, so to speak, but the uterus is sterile, and it stays sterile because the cervix, that plug in it, so nothing gets into the uterus when it's not supposed to. But in your fertile window, we want sperm to get in there. So what the estrogen does is it makes this plug, which is kind of like a stuffy nose, turn into a runny nose, allergies like. And so not all the time, but most of the time you will see it because you will actually have a discharge with that mucus. Some gals don't. Some gals just hold on to that mucus and it doesn't always come out, or they don't notice it, so to speak. So, but cervical mucus getting thin and watery like that is another sign that you ovulated. What else, Terry, am I missing here?
Um,
Progesterone, temperature, cervical mucus.
There's also cervical positioning. Some people check that.
Yeah, I don't like that. I don't want you sticking your fingers up and feeling around in your cervix because of what I just mentioned a minute ago. But she's right. Terry's right about that. I'm not going to talk about it because I don't like it. Good question, though. Okay, here's another question. Can you ovulate one day after your cycle? Now, I'm guessing that question means one day after your period.
That's our guess too.
Right? So, periods are usually, they can vary from 3 to 7 days, right? Usually they're 3 to 5 days. Generally, no. You usually need about 10 days to grow a follicle. Now, if you're somebody who's like, oh my gosh, I bleed and then I spot, the whole thing lasts about 9 days. I don't care. That's fine. You could still be growing a follicle during that time. But generally, you need at least 10 days to grow a follicle. So no, you shouldn't have a peak right after your cycle. Another question, do you ovulate after your first positive OVK test or after the last one? Say if both have identical values in the app. Well, not usually, you are going to ovulate 24 to 36 hours after your LH surge. Remember, you only have one LH surge. So usually the app will pick a peak and it will decide which one. And you will ovulate, like I said, roughly a day after that. So remember, that's why those are the two important days to have sex, the day you hit peak and the day after. Now, I'd love for you to pepper the days beforehand with more sex too. Okay. More questions. What can help regulate cycles after a miscarriage? Nothing. Remember, if you just joined, but earlier I talked about how your hormones are they're not back into sync yet. And there's not, and you really want to wait for your hormones to get back into sync. That is also a good sign that your body is ready to be pregnant again. So when it comes to things like miscarriages, I had a baby, I coming off IUDs that have hormones, birth control pills, Depo, let your body get back to normal. Don't force it because that, we got to listen to our body sometimes. I have PCOS, join the club, and wondered if there are, I answered this earlier about the acne treatments. We talked about that a little bit. PCOS, right?
Do you want another live one?
Yeah, please go right ahead.
We just got another live one. This is a fun one. If your mother and aunt both had twins, does that increase your chances? Is having twins genetic?
That's an awesome question.
Yeah.
Yes, it is. But let me be specific. Only for fraternal twins, non-identical. And the reason is because if a gal just naturally gets pregnant with fraternal twins, again, they're not identical. That's when you see boy, girl. It could be girl, girl, boy, boy, but they're not identical. That means she ovulated 2 eggs that cycle, didn't she? She had to have because she had one baby from one egg and one baby from another egg. So can it be genetic that gals ovulate more than one egg in a cycle? Yes, it can. And that's why they'll say, so not so much from your husband's side. I don't really care what his aunt did because she's no relation to you and his sperm have nothing to do with it. But if you have females on your side of the family with fraternal twins, non-identical twins, then yes, you have a higher chance also of being somebody who can ovulate more than one egg in a cycle and get pregnant with fraternal twins. Identical twins come from one egg. And what happens is after that egg fertilizes, usually while it's coming down the tube, getting ready to settle into the uterus, it will split into 2 embryos. That's why they're identical. All the hormones and genetics are identical with both of these, and that's why you have identical twins. But that has nothing to do with genetics. Good question, though.
Mm-hmm.
Okay. Should men take vitamins to enhance fertility? Absolutely. Now, you guys have heard me talk about this before. Pardon me for 1 minute. Son, can you turn that off, please? Thank you. Sorry. Old lady, where was that? Men vitamins. Okay.
Yeah.
So men make sperm every 2 to 3 months. So they're like a sperm factory. They're always making it. They're opposite from women, right? We're born with all the eggs we're ever going to have. Nothing you can really do to hurt them, nothing you can really do to help them. But with sperm, that's not the case. Men can impact their sperm quality, their count, etc. If he's being a bad boy, what's a bad boy? He's smoking, number one. If he's smoking weed regularly, not good. If he's in hot tubs a lot, not good. If he likes to wear tighty whities, do those even exist? That's a problem. If he rides a bike all the time, these are things that would impact the testicles or the sperm producing factory down there. So he needs to be on decent behavior while he's trying to conceive. One of the ways to help that is to put him on, I want you to Google, or again, go to our friends at Amazon and just search for male fertility supplements. I don't care what brand, they're pretty much all the same. They have nice antioxidants in them. And he's making sperm cells. So we need those good antioxidants. So any man who's trying to conceive, he should be taking a multivitamin and these fertility supplements. So yes. Going on. Oh, our good friend, our nurse friend, Stephanie Kagan always says, eat a handful of walnuts too. Oh. So do that. Yeah. All right. Where are we at now? What time is best to test for ovulation? We talked about this at the beginning. Generally, we say afternoon-ish because you tend to have an LH surge in the morning and it shows up in your urine later on. That's our default answer. The longer answer is, if it works better for you to do morning, then do morning. I happen to be a fan of do it twice a day. So now don't worry about it. Just do it twice a day. At best 12 hours per can. That way we won't miss anything. Okay. I've been tracking my cycle for a while now and still haven't been able to get pregnant. I've done everything and nothing happens. Okay, remember I talked about earlier, there are 3 components to getting pregnant: the egg, the sperm, and getting the sperm to the egg. So usually, again, you can test for 2 and 3. Get your tubes tested. Make sure you're having plenty of sex. Be laying down for 5 to 10 minutes after sex. Obviously, make sure he ejaculates inside. Number 2 is sperm, and that's get a sperm test. We could check that out easy enough. But what tends to be the problem is that we haven't hit a good egg yet. Now, how old are you? Are you 25? I'm a little bit more optimistic. Are you 36? I'm not as optimistic anymore. Your eggs are getting older. So it's getting harder to get pregnant. We have to wait for that good egg, and then we have to time everything just right. So it can easily take up to a year. And that's with you doing everything perfect and nothing's wrong. We just haven't had a good egg ovulate yet. And that happens even for the young girls in their 20s. Half their eggs are abnormal. So, if you guys are driving around in a car that's 25 years old, the parts and pieces aren't as good as something that's only 2 or 3 months old, like men over there who can have babies when they're old. Okay. What do I look out for while tracking fertility at home? Well, we talked a little bit about this a minute ago, and that's obviously the LH testing and doing the BBT, the basal body temperature. Cervical mucus is a good way to tell when you're fertile. Again, Terry brought up their cervical positioning. I'm not a big fan of that. Again, remember I mentioned a minute ago that the cervix is a really solid gate to protect the uterus. So I don't really want you sticking your fingers up there, checking out the position, and I don't really think that helps too much. That's a good question. Can you help me understand how the probability that you have a 1 in 5 chance of conceiving at any given cycle comes about? Well, remember, this is all statistics. When I say you've got a 20% chance of getting pregnant, there is no 1 month that you go, guess what? I'm so lucky I'm 20% pregnant today. That's not how it works. It works either 0% or 100%, right? But what I mean is, when I say you have a 20% chance of getting pregnant, that means if I lined up 5 women who are 30 years old, okay, 5 women, and everything else was working fine, tubes are open, sperm is great, she ovulates regularly, the whole 9 yards. In 5 months' time, they will all eventually get pregnant. one will get pregnant each month statistically. Somebody's going to be that, oh, I got pregnant the first month I was. Somebody's going to be that, and somebody's going to think something's wrong with her because she didn't get pregnant till the 5th month. This is just statistics. And you have a 1 in 5 chance of getting pregnant any particular month. That's how statistics work. I think, Tara, I might have hit all of my questions.
Okay. We don't have any other live questions. We'll give you a minute or two in case anybody has any follow-up questions.
Okay. Let me think about what I get. Now, I'm over in Ask an Expert. Some of you may have been over there. And Terry, we put the webinar out there for people to watch later. So if
Yes.
Okay.
I'll probably have it up Sunday.
Okay. So I love our little cozy group here. These are all my little friends that always come to join. But I know there'll be others out there watching afterwards as well. But I'm over in Ask an Expert all the time. And probably the most predominant confusion that happens in the app is, when you're looking at your chart, you have those lovely little lightly shaded purple column, and then you even have like a single darker purple column. And we're actually looking not to change it per se, but to make an addendum to it, because what those purple shaded areas are nothing but the app suggesting when it thinks you might ovulate. There's like a whole bunch of maybes in there. Did you hear that? So, because it's trying to guess based on maybe your cycle length that you told it or what have you. So that's all that is, just to kind of give you a vague idea. But sometimes, and this is the part that's getting at, it doesn't say really clearly, predicted or what have you. So a lot of you think, oh, that's when I ovulate. So if you don't ovulate right on that dark purple column, you think something's wrong, or you think you missed ovulation. I've had gals in a panic thinking they were in menopause already. No. That's just a suggestion. Ignore it if you have to, because it's not doing anything. It's just suggesting when you might ovulate. And it does move around a little bit as you do your testing in that. Also, it will, again, after the purple shaded areas, it will actually say 1 DPO, 2 DPO, 3 DPO, when maybe you haven't even hit a peak yet. Again, that's just based on the supposition that, oh, we think maybe you might on a full moon on a Tuesday ovulate on this day. Maybe you won't. So, but a lot of women do usually fall within that window. The app is pretty darn smart, but don't hold it to that, and don't think there's anything wrong with you if you don't hit it just right. What else? DPO, we talk a lot about days past ovulation. Days past ovulation is the number of days you are past whenever you ovulated. That's relevant for a couple of reasons. A lot of gals want to know, when will I implant? When will I become pregnant? Generally, I mentioned a minute ago, when you fertilize an egg up in the tube, up in that little tiny skinny tube, you fertilize an egg, and then it toodles down the tube and drops into the uterus. It takes about 5 days for that to happen. And then the little embryo needs to hatch out of its little shell. And from there, it will burrow into the uterine wall. That will usually happen anywhere from 6 to, let's say, 10 DPO. So it's kind of a big window, but that's when usually you will implant. Are there any signs and symptoms of implanting? Sometimes, but if I lined up 100 pregnant women, probably about 50 of them would say, I had some spotting, a little bit of pink spotting around 7 DPO. And I would say to her, you probably implanted. But the other half of pregnant women will not have any signs of implantation. Sometimes when you implant, you might get if you're doing BBT, you might get a little dip in your BBT. Maybe you won't. So again, I tell you these, half-heartedly, knowing that sometimes it happens, sometimes it doesn't. The other DPO thing that's relevant is people start wanting to know, when can I do my home pregnancy test? I would say most gals probably start at around 10 DPO. Anybody who's talked with me in AAE and Ask an Expert knows, I recommend starting at 12 DPO only because I see what it does to you guys when you get negatives. And I'm here to tell you, again, if I lined up those 100 pregnant women, most of them, more than half of them, will not get a positive home pregnancy test before 12 DPO. What will happen is some do. Some get them really early, like 8 DPO. really, really faint line. And of course, God love them, those gals get out there and they post about it. I would too. And so for those of you watching, it seems like everybody gets a positive at 9 DPO. No, most of them do not, and they don't get on there and post about how they don't get it. But those who do get it do post, and it gives you a skewed view of how many people get it. So, and it just, you know how it is, you think it's tough. And you see that negative and you're just like, that's it. It didn't happen. And you stress yourself out. And I don't like that. I know it's hard to be patient, but I'd rather have you be a little impatient than to be stressed out like I know those negatives cause you. So that's why I wait till 12 DPO. It's my recommendation. All right. What do you think, Tara? Anything else we need to talk about? Or
I think that's a good way to end it. Those are some good ones.
So if you ever do need something, you can come over to Ask an Expert. I'm always there. And if you ever feel like you need something more private or one-on-one, you know, you can always schedule virtual consults as well. Phone, chat, video, whatever you want. What else, Tara? Membership. Memberships are skyrocketing. Did you see the numbers? They're going through the roof. People are seeing the value in them. You get, so, like I said, you guys, this is not easy. I'm going to end on this note. We don't know our bodies. I say this all the time. I drive a car right out there. I have no idea how it works. Well, that's how it is with our bodies. We know we have periods because they're inconvenient to us, but I don't know how that stuff works. That's like something you really have to learn about. And of course, they don't teach any of this in school, not the really hard stuff. So I expect there to be so much confusion out there. And that's why we're here. I don't want you confused. I want to do whatever I can to help you understand this kind of stuff. So there's just sample charts. We've got the whole answer library from Ask an Expert. You guys can get so much information to learn about this so you're not so stressed. And what is the lower level membership, Terry? Silver membership?
So yeah.
You get free ovulation and home pregnancy kit, or it's like a $20 value. It costs like $5 for 3 months then to get the benefit of all of this. So do this, guys. I promise I get no cut of any of that. I say this and I promote this for one reason. The information is there, and it costs the company money to put that out there. So, you know, this is the way we have to go, but we're trying to make it so cost effective for you guys. So, you know, think about joining and think about learning more. Really lowers those stress levels. And join Terry and I every Thursday. We love having you guys. All right. We'll say goodnight, I guess, huh?
Yeah. See you next week.